Welcome back. And the next session is, how do you maximize the use of health data for innovation and recovery? And the moderator is Carina Dantas, and it's a pleasure to introduce her. She has a degree in law and a postgraduate studies in physiotherapy, and over 20 years experience in health and social care. She has an interest in data sharing governance, mainly empowering citizens and fostering awareness in this area. I've had the pleasure of working with Carina on the Digital Health Society's Roundtable program and our calls to action that I mentioned earlier. She is the chair of the Cost Action Net for Age Friendly. She's an evaluator and reviewer for the European Commission. She's written over 200 proposals for funded projects and implemented and managed several of them. So I think she's the perfect moderator for this panel. Carina, over to you.
Thank you so much, Vladden, for the very kind introduction. I now feel even self-conscious of being up to that. But I'm glad that I have 4 wonderful speakers with me today, and they will be much more relevant for the success of this session. And it is thus my pleasure to introduce them very briefly and discuss a little bit about the purpose of the session today. So as Vladden well said, we are going to discuss the use of health data for innovation and recovery. And this comes due to the continuation of the process after the pandemic. So of course, we all understood that it would be so important to have high quality health data, to have it updated. This was very clear during the pandemic period. However, as you all know, we still struggle to access, use and reuse this health data. The speakers today work in several different projects, and they have faced challenges and have found, in some occasions, ways to overcome them. So it will be my pleasure to be discussing with them today, how can we overcome these challenges and how can we progress into the more current and updated use of health data. So for the session, I will be counting with Dr. Giovanna Ferrari from Pfizer. She's the regional labeling lead at Pfizer and project lead for the Gravitate Health project. Thank you for being here. Also, Barbara Di Camillo, full professor in computer science from the University of Padova, and also representing the Brainteaser project. Oscar Zanuto from ISRA and Faber. He is the European coordinator of projects and the Treviso Health Social Care Innovation Ecosystem lead, and is also representing the Value Care project today. Also, thank you for being here to Nigel Hughes from Johnson & Johnson, from the area of R&D, project lead of Eden, and also working on observational health data analytics. So the perfect panel, as you can see, to start discussing with us today the challenges and ways to overcome the use of health data for the future. So thank you all for being here. As you know, we will be having only a panel with questions, so I will try to make the conversation interactive between all of us. Feel free to jump in if you see any issues, and also to the audience, I would say, please feel free to put any questions to the chat. We will try to see them and introduce them if necessary and if it is relevant to the session. So I would start with Barbara. Thank you again for being here. And I would like to ask you to introduce very briefly, if you want, to add anything to what I already said, and to let us know a little bit why data sharing is so important in this current era of artificial intelligence and all of the different applications in digital health.
Well, good morning, first of all. As you were kindly introducing, I'm the scientific manager of the Brainteaser project. That is a project aiming at bringing artificial intelligence in the real life of ALS and MS patients. And this is just one of the many examples in which we need data. And well, data are really important in the era of AI application and machine learning application, because of course these applications are based on data, they learn from data, And the more data they have, the better they learn, also in terms of accuracy, but maybe most importantly, regarding the ability of these algorithms and of these models to generalize. We need to be sure they are able to predict in the proper way when applied on many different populations, and also, you know, on underrepresented subjects sometimes, or at least we need to be aware of their limitations. So that data sharing is really important for both aspects of AI applications.
That is very true. And maybe following this up, I would ask to Nigel, considering also what Barbara said, what would you say are the more social technical barriers to work with health data at scale in this space?
Thank you very much, Carina, and thanks for the opportunity to participate today. I could probably fill the rest of the session just talking about this, I'm sure, alongside all the other questions as well. But very briefly, I think socio-technical barriers, particularly the emphasis on socio, you know, we tend to focus on data, understandably, and technical aspects, methodologies, and so forth. But actually, critical to this is along the whole kind of data chain, if you like, from when data is generated to when it may be utilized for analysis, whether for clinical practice or for research, is trust and trustworthiness. I.e., do I, as a patient and citizen, for instance, trust you? Well, not automatically. You need to prove to me as a research organization or as a data host or pharmaceutical company or whoever it may be, that you are trustworthy. And based on that, bearing in mind that a lot of data is analyzed where, you know, I as an individual, any of us, are not necessarily aware of that. You know, it's protected in some way to ensure our confidentiality and our identity. So that might be kind of at arm's length, and therefore we're very reliant on systems and processes and policies to be in place to ensure that people do effectively the right thing in terms of utilizing data for these purposes. And we have to obviously ensure and be assured these systems are fit for purpose. And of course, alongside that are along the kind of ethical, legal and social, the ELSI implications. You know, there's governance aspects and so forth, you know, ethical oversight. All of these aspects are encompassed, I think, in the more kind of socio versus technical aspects. But the technical aspects, you know, the platforms we use, the networks and so forth, they all need to also support all of these aspects and ensuring that citizens and patients' data is preserved in terms of privacy and is protected. That's a very quick response, I suppose. I could talk at length. And of course, lastly, you know, there are obviously legal aspects to this in terms of obviously legislation, directives, particularly regulations. Now, obviously in Europe, General Data Protection Regulation, the Data Acts, AI Acts, there are more acts coming out, of course, and we need to ensure that there's consistency and complementarity across all of this too. But thanks for asking.
Thank you, Nigel. And what you said perhaps links very well to something I would like to ask Giovanna, which is how can standards overcome this? Can especially interoperability standards play any role to overcome these different aspects and challenges?
Yeah, and I think I'd agree. It follows on very nicely. Trust is very much at the heart, I think, of the work that we're trying to do in Gravitate Health. And as you might be aware, that's a digital health information initiative. We're looking to understand how we can use a digital approach in terms of a platform that will bring together trusted health information from different sources, particularly regulator-approved product information, also health record data though, and utilise that to provide a more sort of tailored experience, if you like, for the end user to support them through their healthcare journey. So we're thinking both in terms of the need for trust in terms of the content that's coming into our platform, but also we have very practical questions that will arise in terms of how the data, for example, the patient data is being held and stored within our platform that we need to address within the course of the project. I think the standards that are coming, or we may see with European Health Data Framework, actually could really help set that wider framework. But I think from just to touch on the interoperability standard piece in particular, I think that's also critical because that really starts to open up silos that exist in terms of current sources of healthcare data. So to take an example from Gravitate Health, and one where we've been quite active as a project, we're starting to see the emergence now of new standards for defining electronic product information using the DHSS FHIR resources. And that really, I mean, that really takes things forward in that you no longer need to sort of treat that type of information in isolation. It can become accessible. You can start to connect it with that wider healthcare landscape. And there's clearly a big opportunity there to maximise value for the end user and for the patient and for healthcare professionals. But in order to do that, we need not only those trusted sources, but we need a way to exchange information across that wider digital health information landscape. So I think that and standards and use of common interoperability standards are really going to be crucial to enable that.
Yeah, that's very true, and let's hope we will walk in that direction. And you said two things that would perhaps link me now to ask something to Oscar, which is on one side you referred to the European health data space, and then the full landscape around health data, and of course this also links to social care, which is the area where you work mostly, Oscar. So how do you think care organizations, their managers and professionals are now having considerations around this issue of the health data spaces?
Thank you, Carina, for asking. So mainly what we see, also thanks to European project that we are running, there's a little bit of lack of awareness in managers regarding what could be doable in terms of innovation and also in terms of benchmark experiences. So it means that, first of all, we need maybe as experts all together to create the right opportunities to disseminate more in the right way, in the right language, which could be this use of a data space. And on the other side, maybe we need to move from what is so-called, let's say, a competitive approach based on results towards more cooperative ones. I mean that integration in care could be, in terms of care pathways, the right way to maximize the use of data when you acquire the data only once, you share them, and let's say all the procedures are not on the shoulder of the patient or citizen, but up to the system. So this is from our perspective. Thank you.
Thank you, Oscar. And I would perhaps now link this. I had a question for Nigel, and now I see also one in the chat coming from the audience that perhaps can be linked. So when having all of these considerations around data sharing, data access, and if we even consider this need to include the data that is collected every day, real world data in the discussion, how do you see this working for the European health data space and a sharing of data that is more at scale? And just to let you know that from the audience, the question that was coming was, how do you feel about including data localization for the EHDS? So I don't know if you can link a little bit of all of this and make a soup out of this different aspects.
Yeah. So first and foremost, I think words are incredibly important. You know, we often use these terminologies like sharing and so forth, and you know, what do we actually mean by that? Access and so on. I think principally, and particularly as we are very much focused now on rather privacy-preserving approaches, whether that's methods, technologies, and governance and laws and so forth as well, we are looking at more and more sophisticated approaches, whether these are technical or methodological, to support privacy-preserving approaches. So a good example, I think, is that more and more we are looking at, for instance, in Europe, the federated type of architectures. So, you know, it's not about exclusivity. You know, there's a role for centralized, i.e. all data gets put into, for instance, a central hub or data lake or some other repository, and therefore is curated there for analysis. But increasingly, of course, there are challenges to that, because you become responsible for potentially very large-scale data sets now across regions, which require a lot of control, protections, obviously invoke aspects around the law, i.e. consent and so forth, very challenging. Federated models are, in some respects, the reverse in terms of keeping data local, curating data locally, maybe with a common data model. So, for instance, harmonizing or standardizing each of the different types of data sets and different institutions, whether they might be electronic health records or claims or registries or biobanks or whatever they may be, but all standardized for common data models. Increasingly in Europe, we're seeing the use of the OMOP, the Observational Medical Outcomes Partnership common data model from Odyssey, the global collaboration. But certainly federated architectures where you standardize data locally, you keep it local, you keep it behind social technical firewalls, so including local governance, of course, as well as technical firewalls. And then you send effectively your request for analysis, your question to where the data is, and return the answer, quite often aggregated data, aggregated outputs. So in other words, you're not moving any data. You're moving information. You're asking maybe metadata, but not actual data. And quite often it's not to patient level data, of course, as well. It may be population level, aggregated and so on. So all of these are protections, of course, within federated architectures. That's what we're working on in the European Health Data Evidence Network, EDEN. That's what European Medicines Agency is doing now within Darwin EU, which is a Pathfinder project also for the European health data space. And there are some allusions to federation in the legislation for EHDS, so it remains a little bit ambiguous. So there are approaches here that can support that. And particularly, that's then a concept more around data collaboration, i.e. various people are working together to support the analysis and the evidence generation, but again, whilst protecting the data. So there's no data sharing, there's no actual access of data as such. And I think this is a model, particularly in Europe, but increasingly worldwide, which is growing in adoption for all those reasons, I think, as well. But I think ultimately we'll end up with hybrids, trusted research environments, hubs, and data lakes, and so on, all linked in maybe within kind of federated architectures as well. But again, ensuring this, it can be localized, but it also can be, I think, kind of protective, and that's really critically important going forward into the future. And I think to a degree, there's some technical aspects, clearly some methodological aspects involved in terms of challenges, but also this is a compromise. You can only ask the questions that the data will allow, if it's suitable and representative. But also we make compromises in terms of if we have to reduce the resolution of that data to, say, for instance, anonymization or pseudonymization purposes, that may reduce our ability to ask certain questions, of course, more and more in the more precision area of medicine, in the more acute areas, as it were, or in dealing with things like genomics and various other things. So this is somewhat problematic. We have to strike that compromise. And I think that's an area where increasingly, particularly in methodological aspects, that's where the debate really will start to focus, I suspect, over the coming years. Thank you.
That's very right, Nigel. And as you were speaking, and especially discussing now in the latest part, the questions of anonymization or pseudo-anonymization, I was thinking of projects, for example, as Brainteaser, Barbara. How would it work if all of the data is anonymized? Is it still working for you, for example, in the scope of a project such as this one?
Well, thank you for the question. Well, from the technical point of view, there are different guidelines and algorithms that can be used to prevent, of course, subject identification and to protect the privacy. However, when different data sets are merged, I think, for example, to the environmental data exposure to pollutions that somehow needs geolocalization. So as was asked before in the chat, well, this data can be really important, but when you link anonymized clinical data to data which somehow contains information related to the geolocalization, then you need to add some noise somehow, because otherwise, if you know how much time a subject spends in a specific area, it's really easy to identify he or she. And there are solutions also to these aspects, because we can refer geolocalization to virtual rather than real places. So there are technical solutions. But anyway, let's say when we link data referring to different type of variables, we need to pay additional attention to guarantee full anonymization. Then if I can add, there are also some, let's say, difficulties that are of administrative type, because in many places in Europe, still in many institutions, one single person must take the responsibility of guaranteeing full anonymization before data sharing, before sharing data. And usually this person is not the one in charge of the research, which is okay, of course, from one side, but also create some difficulties. And I think that even, of course, we must consider a solution like federate learning. At some point, you know, within an area, you need to share anonymized data. And at some point, we should, I think, as civil society, take the responsibility to decide which are the clear and well-defined rules and the policies we want to adopt. I think this is really important. There is still some confusion, I think.
Yeah, I was actually seeing that there's a question coming from the audience referring to the points that were just made by you and the speakers before, saying great points. From your expert experience, what needs to be done on the policy and practical level to ensure that researchers have an access to all data they need for research and innovation? So this very clearly links to what you were saying. And perhaps I could introduce this because it just came now from the audience speaking and asking you, what would you highlight as one specific point you think that is needed on the policy and practical level?
Well, I think that from one side, we need to clarify specific rules for different scenarios. And this is related to the fact that we cannot give the responsibility of data anonymization to a physical person somehow. I think this is too much, and the person will tend, of course, to be protective, both for the data, which is okay, but also, you know, you cannot, as an individual, take this type of responsibility. I think should be a shared responsibility with clear rules.
Oscar, if I can ask you, because we have been talking more on a research and development side, but also looking at the citizens, do you think there's enough knowledge from the overall citizen side to understand the need for data and also digital skills in order to be able to somehow support the collection of this data? Is this also an interesting practical level?
Yeah. We are touching a very delicate point because we still have a relevant digital gap in the system, not only from user perspective, so citizens and patients, but also the ones who are working there, because European countries in the ranking, we are not in the same position, and there are several that are lagging behind, for example, our country with others. So it means that we need to improve this ability in practitioners in such a way that we could, let's say, be in the entire circle of data production, data consultation, data utilization, and so on. But back to the user and the citizen, mainly there's, let's say, something else beside the digital gap that is also, let's say, the suspicious somehow regarding where the data goes, which is the data use. So we need also this institutional transparency, and where the system, the healthcare system, is almost run by public organization. It's important to express and present very precisely where the data are stored, who got access, and so on. Yeah. Thank you.
So from the audience, we had a question asking what can we do to encourage better understanding from citizens? And perhaps if I hear what you say, you would say that we need to give them more information and leave some things more transparent and clear?
Yeah, I think that we could do two things. First is simplify our language, because all that is about ICT and data and so on is for, let's say, a limited circle of people. So we need to have a very popular language. And secondly, maybe also using visual material or presentations that very easily present with a flow or with animations, or let's say very understandable tools, the concept. Because once we present this, I remember, for example, in the perimeter of APAHA, where we worked also together to the privacy preference working group, it was clear that if you present also the consent for that is foreseen by our GDPR regulations, people understand, so we could give the consensus. Otherwise, if they are locked or frozen in complicated words, there's an avoidance. Yeah. Thank you.
Yeah, that's very true. Thank you, Oscar. Giovanna, I think this relates a little bit to a lot of work that is being done in Gravitate Health, and I also think that perhaps there's a lot we can learn from the times of the pandemic and how things were felt by people and also what was possible to do to try to overcome some of these issues. Do you have something that you could share with us around this?
Yes, certainly. I'd agree on both those points. I think Oscar's comments, particularly in relation to understanding, are very much pertinent to what we're looking to do within Gravitate in a slightly different context. Just in terms of, the pandemic, I think the experiences we've all been through there, it's really highlighted and emphasised the importance and the critical need for secure and safe access and availability of public health and healthcare data. I think that the benefits became very clear in terms of facilitating freedom of movement, as well as stimulating innovation, for example, in the context of the vaccines development. So I think the benefits could, were very well illustrated, or the potential benefits. I think more generally, though, the experiences will have led to some degree of behavioural change. People would have had to become very accustomed to working or more of a telemedicine type approach, perhaps in terms of their interactions with the normal healthcare system, and as well as benefits, the fact that they may need to download an app and to show a COVID pass in order to access different locations. So I think the practical impacts of sharing of data became very evident sort of during that period, and hopefully that behavioural shift will be will be an experience we can leverage in terms of future uptake of digital tools moving forward, and perhaps a wider awareness of some of the potential benefits that there are to be found for all concerned, if we can introduce an appropriate and safe framework for, I think I like Nigel's terms there, data collaboration, not necessarily sharing.
Yeah, you go a little bit again back to what Nigel was saying before regarding the concepts, and I would take the opportunity, Nigel, to ask you, in your opinion, back to the question of the audience, what are the practical and policy things that we can try to address to progress further?
Yeah, I mean, I agree with all the prior comments, particularly around simplicity and crystallizing the message, if you like, as it were. I would definitely say we have an imbalance in terms of focusing a lot around perceived risk and with no real kind of proportionality around those risks and likelihood of them happening. Everyone talks about risks of doing X, Y, and Z, And we therefore have a bit of a kind of nihilistic approach that, oh, well, maybe we shouldn't do all of these things because there might be some perceived risk. What we don't know actually is how much of these perceived risks result in potential actual harms and what they may be. And a good example is, for a moment, just consider that actually in some of the real risks to health data, if you look at this from a cybersecurity point of view, it's mostly healthcare institutions, i.e. things like hospitals and so forth, which are dealing with the brunt of data breaches, with ransomware and all sorts of things like that as well. Not so much in terms of the research domain. So we need to have a much clearer understanding of what we're talking about, because I think most of it is remaining to be, theoretical. Meanwhile, we've really got to balance that up with the benefits. So I am personally, this is a personal view, I have the firm opinion that we are working in contravention of ethics by not using data as well, i.e. people suffer or even die because we can't generate the insights that we need to manage healthcare, to understand disease progression, to understand treatment and outcomes, but ensure better quality and quantity of life for patients and citizens. So that's not often, I think, a view taken. It's often trying to protect the data and therefore indirectly the citizen or patient, who may be all anonymous to this. So we are actually in a dilemma here, I think, and we need to balance this in terms of ensuring that we have a more even discussion publicly, particularly in our digitalizing society, which is very, very challenging these days, but really to show also the benefits. And I think there was a mention earlier around the pandemic, but actually of all disease areas, this is an issue. The pandemic is a good example where it acted as a catalyst, if you like, to accelerate quite a lot of this work and maintaining protections. But we saw the fruits of that, the benefits in terms of how we managed the pandemic and to get it under control, whether that's from therapeutics or vaccines or indeed whether or not we should wear a mask or not and in what conditions and so on. We had very little of knowledge when we started, bizarrely, but we obviously have learned a hell of a lot more since, in really short amount of time. So we need to really balance things up, but I do believe that we have a very lopsided discussion currently, and that's really challenging. And ultimately, as I say, and I will reiterate again, people are suffering and they're dying because we don't use data. So we need to balance that, I think, in that respect. And I think we have to have a very open discussion related to those aspects as well.
So who will balance this, and how can we balance this? Maybe these are very difficult questions. But I understand your point, and I agree. But this raises that issue, which is how and who.
Certainly, what we communicate. I think certainly also we need to engage more effectively with the media and other channels. We clearly need to clean up social networks. They're a disaster when it comes to this. Disinformation, I think, spreads 7 to 8 times, according to the research, more quickly than the truth across social networks. So it's appalling actually what we're seeing in terms of the impact on scientific and communication, so forth, particularly to the wider public and society. So we've got some real challenges here that the royal we, not just us here in this webinar, but also, of course, governments, regulators, social networks and media channels themselves and so on. There needs to be a far more ethical and responsible code here, I think, that we utilise to communicate on this, and particularly to control disinformation, because this is also harming people at large. So I think this is actually a societal issue. It's beyond our pay grades. So this is something that we as a society need to take into account, and that comes from the bottom up, but also from the top down.
Those were very good points. Oscar, I would ask you, how would this resonate for social care organizations? Are they open to data sharing? Are they more concerned with protecting the data or with using the results of data, or is this too far-fetched still for the discussion?
Yeah. So in average, what we see is that if depending on who is asking to a care organization to share data, mainly public institutions such as the regions or political level, if we see a clear payback in terms of system, okay, this, let's say, opened the door to the collaboration. It means, for example, in simplifying the number and the kind of software that we are using. For example, I was talking with some of our health department here, and they have 150 softwares to manage several issues with internal troubles in terms of interoperability and also external. So within and between services, it's difficult. So it seems that it's coming the right season, let's say the right era, where if the several actors present which pathway we will have in terms of data, which information, in real-time information, because we are also providing a lot of data that have, let's say, retrospective use, but are not so much useful. Yes, could be for research purpose, for sure, as Barbara before said, in terms of a need of data, but we need almost online real-time data to make forecasts, to see where we are going, and so on. So mainly we need to clarify the purpose, the pathway, the payback. Thank you.
Thank you, Oscar. Barbara, what would you say now on your developer researcher hat? What would you say we can do then to progress on this, also based on the queries from Oscar?
Well, clearly, you know, the data repositories, the European data repositories are a great opportunity, and are of course very important, like you know, the verification European cloud initiatives to share data within the scientific community. Something that I mean, some initiatives that I think are also really important, and we might maybe try to somehow make them more visible, are the sometimes the public challenges in which the scientists compete but also cooperate to solve a specific problem, and data, you know, the objective is quite clear, and the purpose, as Oscar was saying, is also clear, and so all the, you know, verification principles are well clarified. And what is really important also in this context, I believe, is that, you know, the patients associations are involved quite often. We don't just share data, but also solutions, results are shared, and this really creates a community around the problem, and also raise the consciousness, I think. And I found these, let's say, initiatives really important in the context of promoting the culture of data sharing.
Thank you, Barbara. That's very relevant indeed, and leads me to ask Giovanna, how would Gravitate help fit here, for example, or other tools or initiatives you would like to point out?
Yeah, and I think, I mean, in general terms, there's an important opportunity to use health data to benefit the patient, the end user, the other stakeholders. And I think demonstrating those benefits is key to, well, building trust and building confidence in using those types of digital tools. So from a Gravitate Health perspective, I think, you know, we're looking to develop a health information tool that can really actively engage the citizen, the patient, in managing their care. If we can do that successfully, if we can present information from about medicines in ways that's clearer, more understandable, more actionable, then you can start to see how that can potentially translate into benefits in terms of healthcare overall. So with, for example, by improving adherence, you may improve the patient outcomes. So I think really it's about using the technology in a way that can be seen to deliver benefits whilst preserving patient preferences and placing trust at the centre. I think in the sort of digital world in general have moved mostly beyond the sort of concept of one size fits all, but actually we're largely there still from a healthcare perspective. So I think moving away from that, thinking about how we can use, for example, a patient's individual health data that they're willing to share with new digital health tools to produce a more focused experience that can engage them and actively support them in managing their health can certainly reap some benefits. I think also we have, and this is something else we'll explore through Gravitate, we've got an underutilised resource there in terms of the patient and the end user. We don't really have any feedback very often in terms of what their user experience of certainly product information, which is my area of focus, is. We've got the potential to actually think about how we can gather back data from our patients and our citizens, understand how we can then analyse that and utilise that to improve and drive and accelerate progress. So I think there are opportunities to better use our health data, both in terms of how we're tailoring the experience that the patient receives at the end of the day, and also to gather their insights and feedback into the process as well.
Thank you, Giovanna. So from there was a lot of juicy things that you referred to, but if you have to pick one that answers to the main topic of the session, and I'm doing this as a closing remark now because we are about to close in 4 minutes, what do you think is key to maximize the use of health data for innovation and recovery?
It has been said, I think that innovation proceeds at the speed of trust. And I think everything we've heard today on the panel really reinforces that. So I would perhaps leave that as my closing remark.
Thank you, Giovanna. Nigel, can I give you 1 minute also for a closing remark? What would be your key aspect to enhance?
Well, I have to say, I love that comment from Giovanna about innovation at the speed of trust. I think that's fantastic. That's a really great expression. And I think, as we've heard already from all the panelists, there are technical and methodological aspects we can use. There are different models and approaches and platforms. But ultimately, yes, we need to assure trust and trustworthiness. And that, in terms of that data collaboration, it starts actually with data subjects, as it were, crudely, but actually, patients and citizens and others, healthcare providers. People need to see benefits. People need to be able to see in their daily lives, for instance, as we've heard already, that it improves how I manage my own disease and my own healthcare, for instance, or I get new insights that allow me to enhance how I live with illness, for instance, right through to, at a macro level, we see improved therapeutics, medical devices, the diagnostic and other technologies that can improve how we manage this. And actually, I think, as was said earlier, I think by Oscar, that we need very real world, real time almost data that can support, public health policy and management of our healthcare systems, which are under enormous pressure, not just because of the pandemic, but financially and with increasing demand and expectations. So it's critical that we really can show in real time, in real world, benefits that can really enhance the feedback loop that says, yes, using data is a good thing.
Yeah. That was a very good summary of the whole session, I think, Nige. Thank you. And Oscar, do you still have something to add there?
Yes, thank you, Carina. Just maybe the need of have a very clear political willpower, because research says that where we have the right size of investment and the willpower of several actors in working together, giving the right framework, then the other issues follow. It means that we move to the technical side, but mainly if we think about the amazing ecosystem where social and health got very good interaction, is because the land of the region or the county, or depending on the organizational design and architecture, decided to do that. So this is, let's say, our hopeful ambition. Thank you.
Thank you, Oscar. Barbara, back to you to close today. What would be your key point?
Well, I agree that trust is really important, and I agree also with Oscar that we need, you know, a clear political will, and also because I think what is maybe missing is an infrastructural somehow organization, and we need to simplify and homogenize it in order to be able to share data.
Thank you so much. I think this was the perfect wrap up. The session was mainly summarized and a lot of action points were put forward by all of you. Thank you so much. It's a pleasure as always to be talking to you and discussing this. And I think it's the right time now to wrap up and pass the floor to the next session. Thank you again so much, and hope we have the follow-up of this soon.
Thank you.
Thank you very much.
Thank you.